come to the regarding the history taking, and I have already mentioned you. It is the station that totally on your hand, and you are the person. You can acquire every single answers, every single marks from this station, because these are the easiest station you ever had in your skill portion. So I have already mentioned that you do have 20 marks in the history taking. You will get one question, 1 minute in the front of the door, and in the room, inside of the room, you will get 9 minutes. And out of 9 minutes, you will get 6 minutes for taking the history, and 3 minutes to face the uh, cross questions. So every single marks are on your hand if you are prepared enough regarding the history taking. And I don't know why people do really bad in history taking. Just they come to know history taking are very simple. It's a same format. That's why I said they don't really practice a lot in history taking. But don't forget to practice history taking, guys. These are the
Dr.
stations. These are the
Dr.
stations.
Rifat, actually, we are finding difficulty when we are taking history. Nicely, we are asking question, okay, asking so many questions, patients also answering. And while I'm going to present the case, right,
Okay.
what is the positive finding? That time we are making like, like what to say, what not to say. That time we become
I
like
mean, just
clumsy situation.
remember, they are not really bothered with the presentation of the history.
Correct.
Just note it down. They are not really bothered with the presentation of the history. They just my one of in the one station, my examiner asked me whether you would like to present the history or just only say the positive finding. Just I choose the easiest one. Yes, sir, the positive finding. Just the young man, just go on. I just said the positive finding, nothing else. So here the main marks are on the attitude, on how you do take the history, how do you do
Empathy, attitude, eye contact.
way of speaking with the patient, eye contact, head nodding, and sympathy, empathy, and other things. So you do have 15 marks on the medical examiner hands, clinical examiner's hand, and 5 marks on the layman. So don't ignore the layman. Also, you'll have to focus on those portions, right?
Yes.
Okay, so come to the history taking portion. First one is Dr. Sharmin. Would you please read out the question?
Yes, a 65-year-old male has been referred to your clinic from your GP who has been suffering from bleeding in the stool. Please take the history.
Okay, you will get 1 minute. Just it won't take time to read this question. So my advice is always just read the question within 10 or 15 seconds. Then
Okay.
just think about the differentials. Always remember, always try to practice yourself like this way. Just think about the differentials. After that, you just ignore everything. Just you are like a dummy. You just good morning, good evening, sir, like this way. Just start your history taking and always think about the differentials so that you can forget the differentials. So you guys will be found in your textbook. There are so many differentials, like 6, 7, so many things. Just always focus on the main 3 or 4 and sometimes 5, nothing more than 5, because you do have marks other portion. If you are busy with the differentials like 6 or 7 or 8, and you will lose your time and you won't be able to touch other portions, but those things also have so many marks, so you won't be able to finish your history taking, and that will be a great amount of mark. So don't panic with yourself with the differential. Just always, if you have completed with 3, at least 4, and minimum 3, I think your history is okay. But always try to 4 or 5, that would be okay. Just don't go try to go for 5 or 6 or 7 differentials. Just the standard is 4 or 5, I think. So, Dr. Sharmin, your
Before we start, I have a question. In real exam, they will provide a pen and paper, I mean pencil, a
yes.
paper. So before, after entering the room, or before entering the room, they will provide
So after entering the
pen and
room,
paper.
the examiner will ask you whenever you
Sure.
will tell that good evening, sir, good evening, right this way, and will
Okay.
the examiner will ask you, have you read out the question? You will answer will be yes. Okay, this is your question, and just start taking the history. So in front of your desk, like this is you, this is your chair, and you are this person, and this is the table, and this is the patient, and this one, oh sorry, so this is you, this is the table, and this one is the patient. So you are facing like this way, and this is your layman examiner, and this is your clinical examination, and this is the real scenario. So you will have the pen and paper here. So
Okay.
definitely not, this is not you. Basically, you are here. So this is your patient,
Mhm.
and this is you, and this is the paper, and this is the pen, this is the table, and this is the examiner. And if you don't use the pen and paper, they won't interrupt you, but I think you do have marks on using the pen and paper, right? So always try to
Yes.
use the pen and paper, and there's the perfect way to take a history, because you are going to ask so many things, and if you don't write it down, you will forget so many things, right? So always try to make some notes that will bring you some answer mark, right? So Dr. Shami, is there any volunteer who would like to start practice with Dr. Shami? So guys, are you with me? Hello. So,
Yes.
Shami, I
Yes.
can be your patient. Just start.
Oh,
Is your
okay.
time started? Right.
Yes. So should I start?
Yes, your timer has been started. 10 seconds is
Oh,
gone.
hello. I am Dr. Shamin, one of the surgical doctors here today. May I confirm your name and age, please?
Yes, I'm Rifat.
Nice to meet you, Rifat. So today I've been asked to
I'm fine.
assigned to ask you some question regarding your problem, and during our conversation, I might take some note. Is that okay with you?
Yes.
Okay, yeah. Then before we start, can you tell me what brought you here today, and how can I help you?
Okay, doctor, I'm having bleeding through my stool for the last 4 months.
I'm really sorry to hear that. So, do you have any difficulty right now? Any kind of pain or any kind of discomfort?
Okay, I don't have any pain, doctor.
Okay. Could you tell me more details about your problem? Like, when did you first notice that you were passing blood through your with your stool?
I already mentioned that I just developed it 4 months back.
Okay. So, is it like all the time you noticed, or like when you were going to open your bowel that time you were passing blood?
Isn't all the time. It comes and goes. I think it's not present all the time.
So, since last 4 months till now, it's like getting worse or like same as when it started.
I think it's been worse day by day.
Okay, did you notice that? Is it fresh blood or like dark color or any clot?
Okay, it's fresh blood, I think.
Like all the time you're passing like blood or with stool when you were going to toilet, that time you notice that blood is going.
No, doctor, it's not present all the time. It comes and goes, and sometimes it's, uh, but nowadays it's become very frequent.
All right, I'm really sorry to hear that. Can you tell me like how, if I ask you to like tell me like how much it is, one spoon, one cup?
Okay, doctor, it's I didn't measure it basically, but I think it's moderate. It sticks with my stool sometimes. Sometimes it's fresh, but maximum time is mixed with my stool.
I understand. Okay, so do you have any kind of back pain, like any other joint pain?
Uh, no, doctor, not that much back pain.
Do you have any kind of tummy pain while you were passing stool?
Tummy pain, no, doctor.
All right. Did you notice that any kind of skin rash or any kind of vision problem? Anything you have noticed recently?
No, doctor.
Okay. How about your appetite?
not
Uh,
doctor. It's becoming. I lose. I am basically losing my appetite day by day.
okay, how about your weight? Did you lose weight last did you check your body weight last 2 3 months?
Or I didn't check, but I think my clothes are becoming loosened day by day.
Oh, okay. So tell me that do you have any kind of like any itching, any redness, any swelling in your anal area?
No, doctor, I didn't notice anything.
Okay, do you have like a history of vomiting? I mean, you threw up.
And it's throw up. No, doctor.
Okay. Do you have recent history of fever, cough, cold?
No, doctor.
All right. Do you notice that you are bleeding from any other side of your body?
No, doctor.
All right. So can you tell me about your past history? Previously, you admitted to the hospital or any history of surgery? Any major issues?
Yes, doctor. I had an operation 4 years back regarding hernia.
Hernia. All right. Are you taking any kind of regular medicine?
No, doctor. I don't.
Do you have any kind of allergy history, like food, drug, anything?
No, doctor.
So tell me about your family. Like any history, any member of your family is having these kind of symptoms, this kind of problem?
Why would I say you?
Please don't mind. Just it's related to your problem. Some conditions are coming from family. I mean, familial. Genetically, it's coming to one person to another. So it's very important to exclude what is the problem you're having. So to correlate your problems, we have to know your proper family history.
I get it.
Can you please
My
cooperate?
mother was suffering from colon cancer, doctor.
Oh, I'm really sorry to hear that. Doctor, if you don't mind, I would like to ask you some personal question. Is that okay with you?
Okay, my family is also my personal question, I think.
Uh, okay. So regarding your personal question, like what do you do for living? Who is the family member you're
Yes,
living with?
I'm living
What
alone.
do you do for living?
I'm a school teacher.
Cool teacher. Do you have habit of smoking alcohol or drinking alcohol?
Mm, no, doctor. No alcohol.
That's very good. Can you tell me what is the idea, like regarding your condition? Do you have any idea what you are going through and what is your main concern?
Okay, basically, doctor, I do have a very, I am very much worried because my mother also had colon cancer and her main problem was passage of blood. Okay, your time is up.
All right.
So, at first, I would like to come Dr. Sharmin herself. How was it?
Mhm. Uh, how was it? Sorry, Dr.
How was the history?
Oh, history was nice.
Just, just,
He was giving nice history and like very relevant. You was like, when we are going to practice history, we need a partner who will give the relevant, I mean, informations. Then it will
related.
be very easy for us to make a conclusion. But while we are practicing, if the partner is giving so many history, it will make us clumsy. But you are giving the very relevant history. When I'm asking
Examiner
specifically, you are going
is
towards that
good
colon cancer.
situation.
I can notice that one. Yes, you are going through the colon cancer, weight loss, loss of appetite. But you other things you mentioned, no, 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 no. So it's very easy for me to make a conclusion.
Okay, but in your real situation, you also get the most of the time you also get the actor like me. They are present there
Yes.
to make you pass. Don't don't be panic. They will give you the all the relevant history. I got the two patient. One is tonsillar swelling and another one is benign enlargement of prostate, and they gave me the thing that are mentioned in your textbook. They didn't say anything other than this thing. So always try to practice like this way, and always choose those partner they will give you the
I
relevant.
don't know how I was performing, when I am practicing, like I'm talking to you, right? That time my ears is like, on a hot flash. I don't know what I'm saying or which flow
Okay,
I'm going.
so
Anything I missed.
uh, if you don't mind, then I can discuss with your history technique. So at
Yes.
first, Did you take the consent that you would like to uh, talk the patient?
Yes, yes. I said yes. I asked that what's your name. I confirmed. Then I thanked the patient. I said like today I've been assigned to ask you some question regarding your problem. And during our conversation, I might take some notes. Is that okay with you?
Okay. So always don't try to repeat the thing that patient have already mentioned, right? Like patient was,
Yes, yes.
he has been suffering for the paracardial bleeding for the for last 4 months. So you are also asking about the.
Since last 4 months, actually, yeah, that was first it came to my mind. Patient said the 4 months, sometimes they are saying it getting worse last 2 months. History are giving like that. So I was expecting to, I mean, hear from the patient like since last 2 months it get more severe. Since last 4 months it's continuously bleeding like that. That would be a different history. I was thinking patient will say it get worse since
So
last two months.
you are definitely good at every section, but I think you do have a very big lackings in history taking regarding time management, because
Yes.
I was looking at my uh, phone. What about the
Mhm.
time? And you almost consume 3+ minutes regarding the problem, just the problem. So
Yeah.
you do have only 6 or 7 questions regarding the problem when you are asking the that you are passing blood mixed stool. You do have the fixed question from when did it start suddenly or gradually, and then is there any orifices that you do have bleeding or something like this question association. But
Ah, yeah.
you almost consumed 3+ minutes only on this portion. So I think it's a huge lackings. You'll have to work on that. That your condition would be uh, much more better. So
Okay.
you do ask a personal question. I think always family history. Always family history will go after the personal, and always in case of personal history, you have mentioned that I would like to know about you regarding your personal history. Like this way,
Yeah.
you didn't ask about the smoking, because I was just waiting to tell that I am a
I
smoker.
was asking, I asked, did you smoke? Or I two questions I asked at a time. Do you smoke and drinking alcohol?
So these two things are most important. That's why you will have to ask separate,
Separately.
because in case of malignancy, smoking itself is very important. That's why you'll have to give emphasis on the smoking separately, right? So
Yes, doctor.
the first questions are same. Hello, I am Dr. Rifat, one of the surgical candidates. May I confirm your name and please? Okay, nice to meet you, Dr. Sharmin. Today I have been asked to ask you a few questions that you are suffering from. Are you okay with that? Okay. So uh, while I am taking the history, I would like to take some notes. Are you comfortable with that? So did you take the history? Said, told that you are going to note something.
Yeah, I mentioned.
Okay, my bad. I was just preparing what I am going to say. That's why I couldn't.
Yes.
Okay, that's great. So now complete your history. Okay, where are we?
Rifat,
Yeah.
may I have some one a little question? Uh, uh, is it needed to make the patient assured about his confidentiality, like asking him that everything we will ask you will be very much confidential and very much helpful for you?
This thing we'll have to
Do you
say
think?
on some personal history, like in erectile dysfunction. You'll have to say
Yeah,
everything
yeah.
to me. I do you need any
Mm,
chaperone like this. Just the thing on that portion, you will have to ask for the chaperone, or you'll have to mention that you will going to confront every single one.
confidential
Yes, but other
privacy.
thing you don't
Okay.
need to mention.
We should not ask every history. Specifically, we should go through this type of question regarding like erectile dysfunction or UTI, urogenital history.
Yes.
Okay.
Okay, guys, I would like to share another thing with you. While you are taking the history, while you are writing it down, always try to emphasize on your paper when the patient give you the positive finding, right? At first,
Yeah.
when I was just taking the history, my my both of my examiner were trying to look what I am going to write in my paper. They were just especially my clinical examiner was trying to look what I am writing it down. And while I am telling the positive finding, I use my script, and the examiner would also staring at my notes whether I am telling him exactly the thing I have write it down or not. So I always advise you try to give emphasis on the positive findings when just like the way Dr. Sharmin was asking me, is there anyone is in your family is suffering from the same problem? I was just saying that my mom was a colon cancer patient, and she was just saying, I'm extremely fortunate to know that. So you will have to change your voice on this on that point. But Dr. Shamin also changed, but I think that didn't mark the up to the level. So you'll have to make your voice soft, and you'll have to show some empathy. Oh, I am really sorry, Mr. Rifat. I am very much sorry that you have gone through a very bad condition like this way. So you'll have to
Mhm.
change your voice, and is the exam of just stage performing, nothing else, guys. You do have so many knowledge, and knowledge is not the main thing you will they are looking for on that exam. They will look for the professionalism, how deal, how talk with the patient. These are the main thing. I have seen so many person, and even I have practice with so many seniors or juniors, and they do have much more knowledge than me, but they couldn't make them to pass this exam because they don't know how to speak and how to approach and how to keep their professionalism. What is the way?
Like I wrote nothing. I wrote nothing in the paper,
Okay, no problem.
but I was fine.
You will blast next time, inshallah. So, Dr. Shamin, would you like to finish rest of the question?
Yes, are you asking me to present the case?
No, I would like to finish rest of the portion. Like
Oh, okay. Just
you are in,
yeah, what is the idea? Yeah, what is the idea and like concern and expectation from us? And
mm,
I would like to know some, I will ask you some systemic question. Just I will ask you some question, just answer me yes or no.
okay.
And after that, I have to tell
So
him that,
have you completed your ICT?
yeah, idea, expectation, and concern. Yes.
Again, please.
What is the idea? Uh, what is your idea about your condition? And what is your main concern? And what you are expecting from us to do?
Not the three questions at a time. Don't do this. You can ask two questions at a time, but I
Oh,
think
no, I was thinking you were asking what the question. Oh, sorry, I didn't understand. I thought like you were asking me.
okay. Just go on again.
So, yes, sorry, yes, Rifat, can you tell me what is the idea of your about your condition?
Hey, doctor, I think I also have that kind of colon cancer because my mom had this type of symptom at first. I'm very much worried
Mhm.
about that.
Yeah, I'm really sorry about that. Can you tell me that what is your main concern? Like your mom is having that colon cancer, and what
My
is the main
main
concern
concern
about
is
your
that
condition?
I'm losing blood from my body, and please just do something. I'm very much worried about that.
Yes, Dr. Rifat, I can assure you, don't worry. Just we will take the history and we will go through all the investigations. I might say you are in the safe place. Hopefully, we can help you. Don't worry. So, just now you were like, Dr. Rifat, what to ask? Like you answered everything already. What I will ask, like, what is your expectation from us?
Just treat me, doctor. I'm very much in pain. I can't sleep properly. I'm having anxiety, and I'm very much worried. Just treat me as soon as possible.
I, I can understand that what you are going through. It must be very difficult for you since last 4 months you were having this problem. So after the investigations, we can tell you that what is exactly the problem. But I can assure you that you are in the safe hand. So definitely we'll find some way to help you. So I will ask you some questions. Just answer me yes or no.
Yes.
Do you have Do you have any kind of chest pain,
No,
any shortness of breath or
no,
difficulty in breathing, any kind of joint pain or any other deformity,
no,
any problem with your loo or while passing urine?
no.
All right. Thank you, Dr. Rifat. Is there any, sorry, is there anything remaining you would like to inform me I might miss?
Mm, no, doctor.
All right. Thank you, Rifat. Thank you very much for your cooperation.
Okay, doctor. Okay, Dr. Sharmin, you did mind blowing,
I
and
tried.
your performance is very good. But I think still you do have some lackings with your time management, and you are giving so much emphasis, and you are using so many words in so many places where it is not needed. Uh,
Okay.
always try to
I have to make it short. Yeah.
yeah, when you are
The question need to make very short. Yeah, then I can finish within time.
when you are counseling the patient, just don't use so many sentences. Just keep your voice low, show some empathy, and
Yeah.
just assure the patient like this. So, oh, I'm extremely sorry, Mr. Rifat. Definitely, I will do my best. Or so after that, you have mentioned that after. So I have completed my taking the history. I would after that I do some clinical examination and do some investigation and I'll consult with my consultant. So always guys try to practice this way, because after taking the history, you are not allowed to keep the patient alone. You'll have to assure that you'll come back and you will consult with your consultant, and you will do so many things after taking the history. You will do the clinical examination and investigation and consult with the consultant. These three things are very much important. After taking the history, if you just say, okay, I have completed my history taking, thank you very much, that means nothing. That is very unprofessionalism. You are wasting the patient's time for a long 6 minutes, and you have completed your conversation within three or 4 seconds. It's very unprofessionalism. So you will have to assure the patient that okay, thank you very much, that ends our conversation right now. I will do some clinical examination and do some investigation, and after that I would I will consult with my consultant regarding your problem and definitely come back to you, right, Mr. Ifat? That's okay, right? We'll have to assure the patient. Don't keep the patient alone, right? Did you get it, Dr. Shami?
Yes.
Okay.
Yes. Thank you, Dr. Rifat.
So
Yes.
you will have to work very hard on the history section portion. You know everything, but you do have very big lackings with the uh, time management. It's a big deal, and in real time, you will lose some time before starting the exam, because when just going to the exam room and just finding for the paper and pen and talking with the consultant. So you will definitely get just only 5 minutes after all. So you'll have to very much concerned with the time, because all the things do have mark. So don't give that much emphasis on the differentials. So in this case, you didn't ask the all the differentials very properly, I noticed, but it's okay, no problem. If you are if you have done with
No, we can't hear you.
hello,
Hello.
did you get
Oh
it,
yeah, now I can hear you.
okay, okay. So if you are done with 4 or 5 differentials, that's okay. But don't give that much emphasis on the differentials. If you are giving so much emphasis on the differentials, then you will lose marks, lose time, and you won't be able to complete your history taking, because uh, you do have separate marks on the other portion, right?
Yes.
Okay.
I got
Okay.
it.
Dr. Sharmin, can you tell me, could you tell me your positive finding, Dr. Sharmin?
Yes, Mr. Rifat, he came with a complaint of parectal bleeding for since last 4 months, which is getting worse. day by day, and the blood is like occasional comes and go, especially when he's passing stool that time. And he mentioned there is he has no other associated he has like he lose weight in recent days and loss of appetite. He has no other manifestation of inflammatory bowel disease like any skin problem, rashes, and he has no history of vomiting or recent history of fever, bleeding disorder. He has a positive family history. His mother is suffered from the colon cancer, and because of that, he's very concerned. And he's a school teacher, like.
Yeah, okay. You are using
Yeah, I forgot.
so many things in also presentation, right? Just try to use so less words because you
Like it.
have limited time. So just tell the positive findings like this way. Okay, Mr. Rifat came to me
Yeah.
with 60 years old. Dr. Mr. Rifat came to me with a history of passage of blood mixed stool for the last 4 months. He has a significant weight loss, but couldn't mention the exact weight. And
Mhm.
he does also he do have also loss of appetite. There is a family history of the colon cancer and some other differences you would like to mention. Just the main negative one. That's okay, but you
Okay.
don't use so many things like just just you was saying. Okay, forget.
Yes.
Okay,
Okay.
how would you investigate the patient?
So I would like to do some blood investigations and like complete blood count. I would like to do the urea electrolyte, and I would like to do that clotting factor, and I will do that ECG, X-ray, abdomen,
What is the
and
role of the
I would like
ECG in this case? The role of the ECG.
I would like to exclude the atrial fibrillation or mesenteric ischemia is there or not.
Okay, so do you think the patient is having mesenteric ischemia for the long 4 months?
No, I don't think, but I would like to exclude that one. Is there any ischemia or not?
Okay, that's okay. So, how would you confirm your diagnosis?
So I would like to do colonoscopy and biopsy to confirm my diagnosis.
Okay, so how would you treat the patient?
So I have to manage I would like to do the physical examination, including abdominal and the digital parectal examination. And I will discuss the case with multidisciplinary team that like my consultant and oncologist and
Uh,
that hematologist. And I will treat the patient according to staging after CT scan.
Okay, so you are not allowed to treat the patient, right? So you
Yes.
just a senior house officer. So
Mhm.
your work is up to the diagnosis. If they won't usually ask you the treatment, and in case if they do ask the treatment, all the guys, as you mentioned, in case of any malignancies, always don't forget
Multidisciplinary.
to mention I like to treat the patient in multi-team approach, MDT approach. Never,
Multi approach.
never forget this word. If you do have the patient with malignancies, always try to mention this word because you do have marks on it, right?
Yeah.
So I think we have completed our first history. You did really very well. Just you will have to work on your time management, and if you are okay with
Yes.
that, then you'll be able to